In this video, we're going to focus on the blood supply and the lymphatics of the back and the lower limbs. Before we get started, let's give an overview of the blood vessels leading away from the heart. So we have the left ventricle that's going to pump out oxygenated blood. And it does that by pumping the blood through the ascending aorta, so this whole thing is the aorta, and then through the arch, and then down through the descending aorta, and then into the abdominal aorta. Coming off the arch of the aorta, we have a brachiocephalic trunk. That brachiocephalic trunk divides into the right common carotid and the right subclavian arteries. Then also coming off the arch, we have the left common carotid artery and the left subclavian artery. The first branches coming off of the right subclavian arteries are the vertebral arteries. So here's the right vertebral artery, and then here's the left vertebral artery. And they're going to course up through the neck, through those transverse foramen of the cervical spine. This is a diagram showing you what I drew. Here we have the aortic arch, and then we have the brachiocephalic trunk coming off of the aortic arch. It's the first branch off of the aortic arch, and that divides into the right common carotid artery and the right subclavian artery. Then the second branch is the left common carotid artery, and the third branch is the left subclavian artery. The arch of the aorta turns into the thoracic aorta, otherwise known as the descending aorta, and coming off of the descending aorta are these blood vessels that are called the posterior intercostal arteries. So now that we know that general mapping of the arteries coming away from the heart, let's look at the arterial supply of the spinal cord. The main supply of the spinal cord itself is through one single anterior spinal artery and two posterior spinal arteries. The anterior spinal arteries are formed by the vertebral arteries, and the vertebral arteries originate from that first part of the subclavian artery. So let's take a look at this picture. You can see the anterior spinal arteries. They are highlighted in pink. They're in between, you can see them right here in between the intervertebral foramen. That's where they are. And they are a branch from this artery right here, which is the vertebral artery that's traversing through the transverse foramen of the cervical spine. If we follow that vertebral artery down, we can see down here where it is originating from this vessel, which is the subclavian artery. So subclavian artery to the vertebral artery, and then from the vertebral artery into the anterior spinal arteries. This picture is showing the posterior spinal arteries. The posterior spinal arteries also originate from vertebral arteries or branches of the vertebral arteries, and they're going to supply the spinal cord as well on the posterior side, so the white and gray matter of the spinal cord. So we can see the spinous processes here, and then we can see the intervertebral foramen, and then that arrow is pointing to the posterior spinal arteries, and there's two of those. When we look at the spine itself, the bones and the structures supporting those bones, we can see arterial supply for the cervical area, the thoracic area, the lumbar area, and the pelvis area. The cervical spine receives its arterial blood supply from the ascending cervical arteries. Those ascending cervical arteries are branches of the vertebral arteries, and the vertebral arteries, again, are branches from the subclavian artery. In the thoracic spine, it's the posterior intercostal arteries that are branches from the descending aorta or the thoracic aorta. In the lumbar, it's the lumbar arteries that supply the spine, and the lumbar arteries are branches from the abdominal aorta. And then in the pelvis, The lateral sacral arteries are going to supply the sacrum, and those are branches from the internal iliac artery. This diagram is illustrating the deep cervical arteries that originate from a costocervical trunk, which originates from the second part of the subclavian artery, and it's going to supply the semispinalis capitis and cervicis, as well as some of the cervical or some of the spinal cord of the cervical region. So let's just take a look at this picture here so you get a better idea of what I'm talking about. We have the costocervical trunk right here, and that has two terminal branches. And here we have that first terminal branch that I was just talking about, which is the deep cervical arteries. So we can see that deep cervical artery coming off of that costocervical trunk. Then there's another artery that we see right here coming off of the costocervical trunk, and that is called the supreme cervical artery. So we have the supreme cervical artery, and we have the deep cervical artery. We'll talk about the supreme cervical artery in the next couple of slides. The posterior intercostal arteries are going to supply the skin and the muscles of the back and the spine and its contents. So most of the spine is going to be supplied by the posterior intercostal arteries. These arteries also supply the chest wall and the parietal pleura. Most of these posterior intercostal arteries are going to arise directly from the descending aorta. The descending aorta sits off to the left side, so the right posterior intercostal arteries are going to be slightly longer than the left side. So if we take a look here, we can see intercostal means in between the ribs. So we are able to see the posterior intercostal arteries here in between the ribs. The first and second posterior intercostal arteries do not arise from the descending aorta or the thoracic aorta. Instead, they originate from that supreme intercostal artery that originated from the costocervical artery, which came from the subclavian artery. So here we can see the first intercostal artery, and here's the second intercostal artery. The lumbar spine will receive its blood supply from the lumbar arteries, and the lumbar arteries originate from the abdominal aorta. So when we looked at that aorta, and we had the arch of the aorta, and then that turned into that descending or thoracic aorta. As soon as that aorta pierces through the diaphragm, which is a muscle separating the thoracic cavity and the abdominal pelvic cavity, as soon as the thoracic aorta passes through that, it now becomes the abdominal aorta. And so the lumbar arteries come off of that abdominal aorta, and they supply the posterior, anterior, and lateral abdominal wall, as well as the muscles and the skin. Finally, we have the lateral sacral arteries, and they originate from the internal iliac artery. The internal iliac artery comes from the common iliac artery. So we had the abdominal aorta, and that abdominal aorta divided into the common iliacs. So we have the right common iliac artery, and we have the left common iliac artery. And then from that common iliac artery, we have two terminal branches. We have this branch, which is the internal iliac, and then we have the external iliac. The external iliac goes underneath that inguinal ligament and becomes the femoral artery, and the internal iliac is going to give off different branches, and one of the branches is the lateral sacral artery. And so that's going to supply the sacrum and the cauda equina inside the sacrum, as well as the muscles that are posterior to the sacrum, like the multifidi muscles and the erector spinae that go that low in that sacral region, and then the skin overlying the sacrum. So in this picture here, we can see this is the internal iliac. This is the left internal iliac artery, and it's going to give off those branches, which we call the lateral sacral arteries, to supply the sacrum. This is a posterior view of the lateral sacral arteries. You can just see them where they're peeking through the posterior sacral foramen, and that's where they're going to terminate. Now let's look at the arteries of the lower limb. So we said that the common iliac artery, which we see right here, that gives off a couple of branches, main branches, the internal iliac artery and then the external iliac artery. And the external iliac artery goes through the inguinal ligament, which we see right here. And once it pierces through that, it then becomes the femoral artery. So this femoral artery we can see going down into the thigh area, and then that femoral artery will become the popliteal artery on the back of the knee, and then the popliteal artery will divide into the anterior tibial artery and the posterior tibial artery. The anterior tibial artery is on the front of the tibia, the posterior tibial artery is on the back of the tibia. So that is the continuum from the external iliac artery. The anterior tibial artery then has branches that will supply the foot, and that's called the dorsal pedis artery. Let's take a look at these two diagrams. The one here on the left shows the abdominal aorta dividing into, and I didn't highlight this area here, but this is the common iliac, and then that divides into the external iliac and the internal iliac. The external iliac then becomes the femoral artery. In this picture, what we're seeing is this is the external iliac becoming the femoral artery, and then the femoral artery becoming the popliteal artery near the knee. This picture is showing the popliteal artery then that's right behind the knee on the posterior aspect of the knee. It's a continuation of the femoral artery, and it will divide into the posterior tibial. This is a posterior view of the knee and the leg. And then this is the anterior tibial that goes to the front in between the fibula and the tibia, and then it'll just run down onto the anterior aspect of the ankle. This is a nice table that that just describes the arteries of the lower limb. So first we have the femoral artery. That's going to supply the thigh, external genitalia, anterior abdominal wall. And one of the branches of the femoral artery is the deep femoral artery. The deep femoral artery, as we saw when we were dissecting, the deep femoral artery branches off pretty quickly in that femoral triangle, and it dives deep, and it will supply the thigh, the knee, and the femur. Then the femoral artery becomes the popliteal artery, not the deep femoral, but the femoral artery becomes the popliteal artery. And the branches of the popliteal artery include the posterior tibial artery and the anterior tibial artery. Posterior tibial artery will supply the knee and the leg, and the anterior tibial artery will also supply the knee and the leg. Branches from the posterior tibial artery are the fibular branch, the medial plantar, and the lateral plantar branches. The fibular or peroneal branch supplies the calf and the peroneal muscles in the ankle, whereas the plantar muscles are going to supply the foot. The anterior tibial artery has one main branch, which is the dorsalis pedis, and that supplies the dorsum of the foot, whereas the plantar arteries from the posterior tibial artery, they supplied the plantar region of the foot. So let's take a look at these. We'll start by looking at the deep femoral artery. So this is the femoral artery, and very quickly in that femoral triangle, we see that deep femoral artery branching off from that. It will supply the thigh, the knee, and the femur. Next, we look at the posterior tibial and the anterior tibial. Remember that the posterior tibial and the anterior tibial are branches of the popliteal artery, which is a continuation of the femoral artery. So the posterior tibial artery that we're looking at right here originates from the popliteal artery. It will supply the muscles of the posterior and the lateral compartments of the leg, as well as the fibula and the tibia, and we can see how it wraps around that medial malleolus. One branch of that posterior tibial artery is the fibular artery, which we see right here. So there's the fibular artery, and this is the posterior tibial artery. The fibular artery supplies the soleus, the tibialis posterior, the flexor digitorum longus, and the flexor hallucis longus, as well as the fibula and the calcaneus. So let's not confuse the location of this fibular artery with the anterior tibial artery. This is the popliteal artery right here, and it divides into the anterior tibial, which goes to the front of the tibia, and then the posterior tibial artery. And then we have this fibular artery that comes off of the posterior tibial artery. In this diagram, we see the branches of the fibular artery and the posterior tibial artery. So we'll look first at the fibular artery, which is right here. And the fibular artery then becomes the lateral plantar artery. On the other side, we see the posterior tibial artery that wraps around that medial malleolus to become the medial plantar artery. In this diagram, we see the anterior tibial artery as it branches off of the popliteal artery. So this is the anterior tibial artery, and it courses through that tibia and the fibula to the front of the tibia, and it comes down to the ankle, and it will supply the muscles of the anterior leg compartment. Now let's take a look at the veins of the lower limb. The veins of the lower limb are going to be closely related to the arteries of the lower limb. The veins consist of both deep and superficial groups, and the distal deep veins are going to be paired. So there's going to be two instead of just one, and then they follow the path of the arteries. Beginning with the deep foot veins that are paired, they will become the anterior and posterior tibial veins, and they unite to form the popliteal vein that then becomes the femoral vein, and then the femoral vein becomes the external iliac vein. So that looks like this. We have the posterior tibial vein, the anterior tibial vein, and they become the popliteal vein. And that popliteal vein becomes the femoral vein. And the femoral vein becomes the external iliac vein. And that happens once that femoral vein pierces through that inguinal ligament. And then the external iliac vein joins with the internal iliac vein to become the common iliac vein, and then the common iliac vein will, the two common iliac veins join together to become the inferior vena cava. Draining into the posterior tibial vein are the fibular veins, otherwise known as the peroneal veins. So here we see a diagram of these veins, and we have an anterior view and a posterior view. We can see the popliteal vein right here, and into that popliteal vein drains the posterior tibial veins. So there's the posterior tibial veins that are draining into that, as well as the anterior tibial veins, which are right here. So they drain into that popliteal vein. The popliteal vein then drains into the femoral vein, and the femoral vein becomes the external iliac vein, which becomes the common iliac vein as soon as the internal iliac vein joins it. The right and the left common iliac veins then come together to form the inferior vena cava. The inferior vena cava then goes to the right atrium of the heart. On the other side, we see the anterior view, and with the anterior view, we see the anterior tibial vein, how it has to go to the back of the leg, so it goes around the back of the tibia, and it will join with that posterior tibial veins. There's two of those posterior tibial veins, join with that anterior tibial vein to become the popliteal vein. This picture is showing the femoral vein, which is a continuation of the popliteal vein. So the popliteal vein is down here, and then it turns into the femoral vein, and then the femoral vein becomes that external iliac vein. There are two major tributaries into the femoral vein. One is the great saphenous vein, which runs all the way up from the ankle on the medial aspect of the thigh, and the other one is the deep femoral vein. So this picture actually isn't showing the deep femoral vein, but so this artery right here, this one right here, that's the deep femoral artery, and the deep femoral vein will be coming right on the side of that. And so the artery is delivering the blood, and the vein is returning the blood back to the heart. So the deep femoral vein drains the lower limb, and it drains into that femoral vein. There are two major superficial lower limb veins. One is the great saphenous vein. It's the longest vein in the body. It originates over the dorsal and the medial side of the foot, and then it ascends along the medial side. So here we see it ascending along the medial side and thigh, and then it will empty into that femoral vein. The great saphenous and even the small saphenous veins are often used for coronary bypass surgery. This is a picture of the small saphenous vein. The small saphenous vein begins over the outer side of the foot, and then it ascends along the posterior leg to the popliteal vein. And then from the popliteal vein, blood drains into the femoral vein. This diagram shows the dorsal venous arch. So that's this arch right in here. And maybe I should do it in yellow. So here's the dorsal venous arch right here. And draining into that are these dorsal metatarsal veins. So metatarsal veins are in between the metatarsal bones. And they drain into that dorsal venous arch. And then we also have these dorsal digital veins, digital meaning by the toes, and they're draining into those dorsal metatarsal veins, and then that all drains up in towards that dorsal venous arch. Then there's also these medial and lateral marginal veins that will connect with that dorsal venous arch, and they all come together then to drain into the anterior tibial vein. Let's switch gears now and look at the lymphatic system. The lymphatic system consists of a lot of different components. We're basically looking at the lymph nodes and the lymph vessels, and there's two different types of lymphatic vessels. There's superficial lymphatic vessels and there's deep lymphatic vessels. The deep lymphatic vessels are larger vessels that accompany the arteries and the veins. The superficial lymphatic vessels are located in the skin and the mucous membranes and the serous membranes that line the joint cavities, and then the deep lymphatics are deeper in the body and are located closer to the organs. These lymphatic vessels join together to form large lymphatic trunks, and then they empty into two major collecting vessels, either the thoracic duct or the right lymphatic duct. This diagram is illustrating those components of the lymphatic system. So there are several lymph nodes, and then we have these lymphatic vessels. The lymphatic vessels are different than arteries and veins because, as we know, arteries and veins, we have arteries leading away from the heart, and they become capillaries, and they drop off their oxygen, and then the capillaries now have no oxygen, and the capillaries join together then to form veins. And there's this circuit then from the heart where in the heart we have the left side of the heart pumps out the oxygenated blood into the arteries, and then those veins, which are carrying the deoxygenated blood back to the heart, drain into the right atrium. The lymphatic vessels are different because they're not a circuit. Instead, they have an end to them, and then they carry the fluid back toward the heart, and then they dump into the subclavian veins. So they're picking up basically any excess fluid that's in the interstitial fluid that has been pushed out by the blood vessels. So as the blood is delivered by the arteries to the tissues, it pushes out fluids and other things, and then most of the fluid is brought back into those capillaries and then into the veins. And any excess fluid that didn't return into the circulatory system will then go into the lymphatic vessels. And then those lymphatic vessels will deliver that excess fluid back to the subclavian veins and dump that fluid back into the circulatory system. Along the way, that fluid has to go through these small organs that are called lymph nodes. And those lymph nodes are attached to those lymphatic vessels. The lymph nodes contain B cells and T cells and macrophages, which are going to help to clean up that fluid before dumping it back into the blood. So it's just a way to clean up the fluids in our blood. So there are different lymph nodes in different areas of the body. The cervical lymph nodes are found in the neck area. The axillary lymph nodes are found in the axillary or armpit area. The lumbar lymph nodes are found in the lumbar area. And then on the next slide, we're going to see some other lymph nodes. So on this slide, we can see additional lymph nodes. We see the pelvic lymph nodes, and we see the inguinal lymph nodes. All lymph fluid will be directed back towards the heart. And the body drains all that lymph fluid into two main vessels that drain into the right subclavian vein and the left subclavian vein. The right lymphatic duct will drain into the right subclavian vein, and the thoracic duct will empty into the left subclavian vein. The right lymphatic duct will collect lymph from the right jugular trunk, the right subclavian trunk, and the right bronchomediastinal trunk. Those trunks then receive lymph from many other smaller lymphatic vessels. The thoracic duct starts as the cisterna chyli. The cisterna chyli is the very base of the thoracic duct. It's an expanded area which receives lymph from the right and left lumbar trunks and the intestinal trunk, and then the cisterna chyli becomes the thoracic duct. In addition to the cisterna chyli, the inferior segment of the thoracic duct will receive lymph from the left bronchomediastinal trunk, the left subclavian trunk, and the left jugular trunk before it empties into the left subclavian vein. This diagram is illustrating how lopsided the lymph fluid drainage is between the thoracic duct and the right lymphatic duct. The right lymphatic duct is only going to drain lymph from the right upper limb, from the right side of the head, and from the right chest area, whereas the thoracic duct is going to drain all of the lymph from the rest of the body. So the thoracic duct carries lymph from tissues inferior to the diaphragm. So here's the diaphragm. So anywhere inferior to the diaphragm is going to drain into the thoracic duct. And then from the left upper limb and from the whole left head and all of the left side of the body. So it's a very lopsided between the right lymphatic duct and the thoracic duct. This diagram is illustrating the thoracic duct and the right lymphatic duct. Let's first look at the right lymphatic duct as it empties into the right subclavian vein. This right here is the right subclavian vein, and get a little bigger here. This right here is that right lymphatic duct, and so that's only draining the right arm, the right chest, the right side of the head. Then we have the thoracic duct over here, which is draining the whole rest of the body. And this very base right down here, that's the cisterna chyli. And then that drains into this long duct here, which we call the thoracic duct. And then that drains into that left subclavian vein, which is right here. Here's another picture showing the thoracic duct and the cisterna chyli. Cisterna chyli is the expanded area at the base. And then we have this long thoracic duct, which is going to drain into that left subclavian vein. Then here we have a larger picture showing the very end of the thoracic duct as it's draining into the left subclavian vein, which is right here. And then there's other tributaries that are draining into that thoracic duct other than the cisterna chyli at its base. All lymph fluid and all those lymph vessels flow towards the heart. In the cervical area, in the nuchal and shoulder regions, all the lymph from the superficial and the deep sources are going to flow into the cervical lymph nodes. So this is showing in purple. We can see all the different lymph nodes in the cervical region. So those are the cervical lymph nodes. And then in other areas, the lymphatic drainage is divided into superficial and deep systems. But in the neck, both the superficial and the deep drain into those cervical lymph nodes. Let's first look at the deep lymph flow of the back. There are deep lymphatic vessels that carry lymph from internal organs. These deep lymphatic vessels are accompanied by the arteries. So they're going to run alongside those arteries. The deep lymphatic vessels are deep in the body. For example, they're deep inside the abdominal area. They will drain into collecting ducts, and then those collecting ducts will empty their contents into the subclavian veins. The subclavian veins, the location of those are right underneath the collarbones or the clavicles. In the thoracic region, the lymphatics from the skin and the subcutaneous layer drain into the axillary lymph nodes. And then in the lumbosacral region, they drain into the superficial inguinal lymph nodes. Lymph from the musculoskeletal structures of this region, of the thoracic area and the lumbosacral region, will be filtered by the nodes which lie alongside the spine. This diagram is showing the superficial lymph flow of the back. So we can see in purple, those are lymphatic vessels that are flowing into the deep lymphatic vessels of the spine. This diagram is showing the location of the axillary lymph nodes, where all of the skin and subcutaneous layer drains into in the thoracic region. In the lower limb, most of the lymph will drain into lymph vessels that follow the superficial veins to the superficial inguinal lymph nodes. These lymph vessels will follow the saphenous veins, both the great and the small saphenous veins, toward the inguinal area. Some lymphatics will follow deep veins to the deep inguinal nodes. And then the lymph drainage from the lower limb will then pass deep to the external and common iliac nodes of the trunk. The lymphatic vessels of the lower limb can be divided into two major groups, the superficial vessels and the deep vessels. Their distribution is going to be similar to the veins of the lower limb. This diagram is showing the location of the superficial inguinal lymph nodes. This diagram is illustrating the deep inguinal lymph nodes in purple. The deep lymphatic vessels of the lower limb are fewer in number than the superficial vessels. They're going to accompany those deep arteries of the lower leg. They're found in three main groups: an anterior tibial group, a posterior tibial group, and a peroneal group. So we have the anterior aspect of the leg, the posterior aspect of the leg, and the lateral aspect of the leg. They're going to follow the corresponding arteries. They enter into the popliteal lymph nodes and then ascend towards the inguinal lymph nodes. This diagram is illustrating the superficial veins and the lymphatics of the lower limb. So in the first picture here, which is an anterior medial view, we see the superficial lymphatic vessels that are converging toward, and then they accompany that great saphenous vein, and they will drain into the inferior group of superficial inguinal lymph nodes. In B, this is a posterior view of the lower limb. We can see the superficial lymphatic vessels of the lateral foot and the posterolateral leg that follow the small saphenous vein, and they drain initially into the popliteal lymph nodes. The vessels leaving the popliteal lymph nodes will then join other deep lymphatics, and they'll accompany the femoral vessels to drain into the deep inguinal lymph nodes. This ends this video on the blood vessels and lymphatics of the back and the lower limbs.